Hello, I'm Matt Galloway, and this is the Current Podcast.
There are 17 supervised consumption sites in Ontario where people battling addiction can safely take drugs to reduce the risk of overdose. But that number will soon go down. Ontario Health Minister Sylvia Jones announced this week the province is shuttering 10 of them, citing public safety concerns.
Residents near Ottawa sites are concerned about the drug-related crimes in their community. And in Toronto, there's been numerous stories of altercations, stabbings, and even a homicide. Our first priority must always be protecting our communities, especially when it comes to some of our most innocent and vulnerable, our children.
All supervised consumption sites will be banned from operating within 200 meters of schools or childcare centres. The provincial government says it will instead invest $378 million in new homeless and addiction recovery treatment hubs. Sarah Gregg is Director of Substance Use and Mental Health at South Riverdale Community Health Centre in Toronto. They run 2 safe consumption sites, both at risk of closure. Sarah Gregg is here with me in studio. Good morning.
Good morning.
How did you react to Sylvia Jones's announcement?
I think it took us all by surprise, frankly. It's not in line with what evidence has told us about the usefulness and effectiveness of the sites. And honestly, my initial reaction was what's going to happen to the people who rely on these sites for a multitude of health interventions, community, a safe place to be, for food, for connection, for integrated and wraparound care that is provided at all of these sites.
What are you concerned will happen?
Well, I'm concerned about preventable overdose deaths. That's my main concern. I guess my secondary concern is that how will people gain access to the same level of complex integrated care for basic healthcare needs?
Help me understand that. What are the services your team provides?
When the sites first opened, the primary service was overdose response. And that was the biggest part of our service. And that was 6 years ago now. So now that's the smallest part of our service. And what we spend the most time doing is providing integrated healthcare and wraparound services. So things such as wound care, STBBI testing and treatment, post-injury care, post-surgery care. We provide appointment reminders and accompaniments. We visit people in the hospital. We make connections to families who are looking for their children who are now probably adults. We have volunteer opportunities. We have daily chill space activities. We have trauma-informed programming and groups. We have access to addiction medicine professionals and primary care physicians. We also have foot care on site. That's been the newest thing. So we keep building what it is that people need from us, because what we've learned is that the services need to come to the people, and we can't expect people without stability in their lives to go several different places to get that care.
And what do they tell you about being able to access that care?
Well, it's where people feel comfortable. People feel safe there, and people come there every single day. We have some visitors from time to time, but there is a core group of people that receive intensive wraparound care from our sites.
Minister Jones and others have raised concerns about these sites being close to children in daycares and schools. How do you respond to parents and families who are worried about having their children near consumption sites?
Well, I think everyone's concerned about children's safety and neighborhood safety, and that's a concern that we share. That's a concern that we can continue to work on as communities. You know, I think for anyone looking in, I think the proximity to school seems like a reasonable kind of request. And I also know that I've been looking for an alternative site for one of my locations. And in the city of Toronto, it's very difficult to find a place that's outside of that radius. And that being said, the other piece of it is that this is a healthcare service, right? So when we talk about consumption sites, we need to be referring to them as healthcare centers, because that's what they are.
It's been just over a year since Carolina Hubner-Macarat was killed by a stray bullet near the safe injection site where you work. How do you respond to people who are worried about being close to these sites after a tragedy like that?
You know, it's an absolute tragedy what happened to that woman and what's happened to that family. I can't begin to understand the grief that they must be feeling. I guess the follow-up to that, in the other part of your question, people feeling unsafe now, I think people, unfortunately, in the city of Toronto experience gun violence in many, many places. not only near healthcare centers. So it was a tragedy. And every time we experience a tragedy, we can't shut down the essential services where those tragedies occur.
Critics of these sites, including a doctor that I'll be speaking to next, have said that advocates have lost sight of the ideals of this kind of harm reduction healthcare. What do you say to that?
I guess I don't really know what that means. My experience is from the front lines of the overdose crisis and physically bringing people back to life over and over again from preventable overdose deaths. I would also say the tragic and undignified ways that people have died on the streets of Toronto. It's a humanitarian crisis. In my mind, it's not a binary. It's not treatment or harm reduction. Those things are on the same spectrum, and we support people along the way. And what I've learned is that abstinence-based models work for many people, and abstinence-based models fail many other people.
What will happen to those people who access your site and your health care if you are forced to close down?
I think that people are already experiencing anticipatory grief of community, of a safe place to be every day, particularly if you're a person that sleeps rough in the city and you're shuffled around from location to location because of the lack of affordable housing in the city. I think people are going to experience it in a lot of ways, and unfortunately I think that people will continue to die, because there's currently not enough services. And I will tell you, over the past several years, I have lost 300 people that I care about to overdose deaths. And that's when I stopped counting. So I think bad things will continue to happen. I don't think we're in a position to say goodbye to the overdose crisis, unfortunately. We haven't worked ourselves out of that work yet, and that should be the goal.
Right. Well, thank you so much for joining us, Sarah. Sarah Gregg is Director of Substance Use and Mental Health at the South Riverdale Community Health Centre in Toronto. Dr. Sharon Koivu is a physician and addiction medicine consultant with St. Thomas Elgin General Hospital. She is in Port Stanley, Ontario. Good morning.
Good morning.
What do you make of Ontario's announcement that they are banning safe consumption sites near schools and daycares?
My first response was, I'm not surprised by this. I am disappointed, but they did have a moratorium where they were actually looking at concerns around supervised consumption sites. If you look at when they started, I was involved, and I guess I want to correct you on one thing. I'm not a critic of supervised injection sites per se. I am concerned about how they've evolved. I actually moved to an area in London that was potentially a site for a supervised injection site so I could be in the community. I was involved in town hall discussions to encourage the community to feel comfortable with having a supervised injection site. But if you look at the drug strategies for Toronto that was made, I believe it was in 2013, and in London in 2017, it's very clear that when there was an exemption to allow supervised injection sites by the Supreme Court, a mandate was to engage your community and to discuss community safety. It's a paramount part of having a supervised injection site. And I feel when I'm talking about ideals, that was one of the things that's been lost, is really engaging the community, helping to make the community feel that they are listened to, supported, and that their concerns around safety are addressed. The other really important part of a supervised injection site is to help facilitate people into other treatments, including recovery. Mm-hmm. Absolutely, we meet people where they are, but understanding addiction, you have to understand how addiction works, how addiction affects people, mm-hmm. and how to help facilitate that. So unfortunately, I think phrases like no judgment, no expectations, and no desire to get off drugs, when people hear that, they feel that they've lost that desire to help people to transition into recovery. And those are the things that I worry about. Harm reduction is important, but it's important to be part of the 4 pillars of addiction treatment.
Well, the people who run sites, safe consumption sites, say that shutting them down will put people at risk and increase pressure on already stretched emergency services. What do you think of that?
I am very concerned about the decision to shut them down. I'm not surprised. We need the 4 pillars. So prevention, treatment, harm reduction, and enforcement working together in a collaborative manner to address the addiction crisis. There have been problems with how some, and not all, but some supervised injection sites have engaged with their clients as well as the community. I'm not surprised, but I'm worried. And I think it's something that we're all going to share today as a major concern for the people that are going to these sites. We have to make sure that there are services available. What will this mean? Will they have access to other sites? What are the alternatives for people who are addressing the need for what is available at a supervised injection site? I'm hoping that the rest of the service is still available. The wraparound services are still available. What exactly will this mean? I think that we need to be concerned, and hopefully there will be a response to that. I think harm reduction has stood alone and hasn't been as collaborative as perhaps it should be. That doesn't mean it should be erased.
Well, the Ontario government says it's investing hundreds of millions of dollars in support hubs to combat homelessness and addictions, so-called heart hubs. Health Minister Sylvia Jones singled out London, Ontario as being an early adopter of that model. How is the model working in your community?
We in London were planning on having 200 beds. We only have 2 hubs opened. If you look at the number of beds that the government is saying they're going to have, it's something like 375, I think is what was listed. That's almost what London needs. Now, London does have 2 hubs that I think are working quite well. One is Indigenous led, and I think this is a really important recognition that Indigenous services need to be Indigenous led, and that is an extremely important aspect of care. And the other hub is for youth specifically. My understanding is that these 2 hubs are working well, but we're far behind in the amount of hubs that had been initially planned in the city by this point in time.
Your support around these consumption sites has changed over the years. Can you help me understand why?
My support for safer supply has changed over the years. And I think that what often happens is the word safer supply and safe consumption sites gets blended. And I think that unfortunately the discussion of those 2 things, because the word safe has been added to the beginning of them, has blended it. I have always promoted supervised injection sites and still do. I support them in how they were intended, which includes all of the things that your last speaker mentioned, but also making sure that they engage with the community and are working to help be a contact person, a contact place to get people into healthcare and helping to facilitate recovery.
And
that's in their mandate.
Who is responsible if that hasn't happened? Like, where does the responsibility lie?
I feel the accountability for this lies in the running of the supervised injection site. Those are outlined. Those mandates are outlined. If those haven't been met, that unfortunately I feel is at the accountability of the people running them. And that's why I think this is so tragic. I feel like people got something so important, but then you have to respect the requirements to keep them. People running these sites mean well, but when you lose your connection to all the pillars, which includes enforcement, it includes treatment and prevention, you have to be working together. And when you get so, I don't know, I hate the word zealous, but I'm going to use sort of zealot, and you feel like I finally got this, I finally have harm reduction, and you lose that connection, this is the fallout.
Well, there's so much stigma around addiction. How can we not lose sight of the people who are at the heart of this crisis, the people who need help in this ongoing debate?
We need to recognize that they can't be just pawns in political messaging. It's so important that we address prevention, and that includes decreasing access to cheap drugs on the street. It's important we embrace treatment and harm reduction and enforcement and work to get a model that really collaborates these, because there are lives at stake when we do things wrong, and those lives matter. But we have been doing this very much from sides, and I think some of that is media driven, that we create camps, and we need to break down the barriers of these camps and start recognizing our strengths, accepting our weaknesses when we're doing something that isn't meeting the needs of others, including the community. We have to acknowledge the weaknesses of programs and move forward collaboratively instead of in hostility, and try to remember that this is about the people who are suffering from mental health and addiction.
Dr. Sharon Koivu is a physician and addiction medicine consultant with St. Thomas Elgin General Hospital. Jillian Kola is a public health researcher who has studied and published several papers related to harm reduction and the overdose crisis in Ontario. Good morning, Jillian.
Good morning.
What do you make of the government's decision to close these sites?
I think it's absolutely shocking. I think that we are in the middle of a toxic drug crisis that has only gotten worse in the last 6 years that the Ford government has been in power in Ontario. I think that we have broad agreement among experts that what we need is a comprehensive approach to address this crisis that includes evidence-based treatment options that are easily accessible. Nobody disagrees with that, but that also includes evidence-based harm reduction services. And we have very strong published evidence looking at overdoses in Toronto and what happened in neighborhoods after supervised injection sites opened, like the one at South Riverdale Community Health Centre. And this research showed that neighborhoods that opened supervised consumption sites had a significant decrease in overdose-related deaths compared to neighborhoods that didn't open these sites. We can also see, based on the data, that every single site submits to the provincial government and the federal government every month that these sites have been incredibly effective at creating connections to the broader healthcare and social service system, as Sarah was describing earlier. In fact, if you look at the federal government data, which is available on their website, South Riverdale alone made 8,000 referrals to other health and social services and treatment. And I think that it's absolutely short-sighted to be closing sites in the middle of a crisis that has only gotten worse before even, as Dr. Koivu pointed out, bringing a single one of these hubs or treatment services on board. We currently don't even have those open. We have no idea what they're going to look like. The plan that the government put forward earlier this week is lacking in many, many details. And so again, I think that we really, really need to focus on having this comprehensive approach.
We just heard Dr. Sharon Koivu say that some harm reduction advocates running these sites have lost sight of recovery as a pillar of what they do. Do you agree with that assessment?
No, I mean, I disagree with that from a number of different ways. So first, we have very strong published public health and medical research showing that supervised consumption sites function actually as a linchpin within the treatment system. They are crucial places where people who are struggling with their substance use and wish to engage in treatment, they go towards their supervised consumption sites in their neighborhood because they know that they have compassionate care there. The issue is there is nothing available. People will talk about being left on hold for hours, being put on months-long wait lists. And again, I think that Dr. Koivu and I would very much agree that we need access and easy access to the best evidence-based treatment. The Ford government has been promising funding for treatment for 6 years now, and it has not delivered. It has not come through. And that's what scares me about this announcement, is because these sites have been doing so much work trying to get people towards effective treatment that just is not there.
I just want to be clear that there was some funding announced for treatment centers as part of this, but as you mentioned, some of the details maybe are not there yet. How do you think the loss of these 10 sites, in addition to the ones the government had already stopped funding, will impact the people who use them?
I think that one of the impacts that we will inevitably see, and very unfortunately, is an increase in overdose-related deaths. The largest site in Toronto at Toronto Public Health has intervened in over 2,000 overdoses. Another issue is that this is going to increase the burden on ambulance services and on our emergency departments. Other thing that I'm worried about that I think bears mentioning is that in announcing these hubs, the government also announced that no hub will be able to provide sterile injection equipment. And this is a major concern in terms of increasing rates of HIV and other bloodborne infections. Distribution of sterile injection equipment has been a cornerstone of our public health response to drug use for over 30 years now, and it is completely wrong-headed. And frankly, I don't understand why they would stop and ban any hubs from providing this fundamental public health intervention, again, in the midst of a crisis that is only continuing.
All right, we'll have to leave it there. Thank you very much for joining us, Jillian.
Thank you for having me.
Jillian Kola is a public health researcher and assistant professor in the Faculty of Medicine at Memorial University.